Welcome to the HealthspanMD podcast. Welcome to the Healthspan Podcast, where we focus on the science of longevity. And today we are going to be talking about one of the biggest threats for many of us to our health and longevity that can fly under the radar, and that is stress. So, if you think the idea of stress being able to kill someone seems far-fetched and a little bit overly dramatic, I understand. I remember in literature class in high school or college, and maybe it was Wuthering Heights, I don't remember, where one of the characters dies of a broken heart. And I thought at the time, oh, come on. But then I fast forward, I'm a brand new finishing my cardiology fellowship. I'm a brand new cardiologist, and there's a story in the paper, a tragic story of a woman. She's in her early 50s. Her son had been tragically killed in war. She sees his body and dies suddenly. And I remember at the time being very perplexed. Like, how in the world does that happen? As a cardiologist, I didn't understand what the mechanism would be. And we're going to talk about something called broken heart syndrome here in just a bit. Now I totally understand how this all occurred. But when I later learned about broken heart syndrome, I went back and pulled up the article of that event, and it was so interesting to me because the doctors they interviewed for the story, a cardiologist said, well, it could have been plaque rupture and all these things. Family said she died of a broken heart. And she died of a broken heart. So, I had my first experience not that long after that with my first patient with broken heart syndrome. And it wasn't really recognized in the United States much at that time. But now broken heart syndrome is a well-recognized type of heart attack. People show up with all the signs and symptoms, chest pain and EKG changes and abnormal blood tests. But they're unique. They're not the typical heart attack, as we'll talk about. And that I've now met hundreds of people that have had broken heart syndrome, and I also know that there are many cases of people dying from broken heart syndrome. And what is the cause of broken heart syndrome? Stress. So in today's Healthspan podcast, we're going to discuss what is broken heart syndrome. How do you know when stress becomes too much? And then what has been proven to lower chronic stress and its impact on our health? And we have a real expert who I'm really excited to introduce you to all here shortly. So first, I just want to talk a little bit about broken heart syndrome. So broken heart syndrome, medical term more commonly used as Takotsubo cardiomyopathy. This is a syndrome. People show up with all the signs, symptoms of a heart attack. But when we take them to the heart catheterization lab and look at their arteries, they have no blockages in their arteries. And yet, half or more of their heart isn't functioning. It's just sitting there. It's not squeezing. And if that person, though, recovers from that event, then they completely recover. The heart function comes back to normal. All of those things, and in most of those cases, in almost every case, it's some kind of stress. It could be death of a loved one, gambling losses, severe pain, anything along those lines. One quick story. I've never been able to tell this in public before, so I'm going to tell it now. So there's this organization that does the evaluation of hospitals called the Joint Commission, and everybody calls them JACO. And they just show up out of nowhere and evaluate hospitals. And if you fail, you're not JACO approved. And I was at a famous hospital, I'll say. I won't say the name. And to not be JACO certified would have been devastating. So people were really high level stress for this. And so one event, the JACO people came, they evaluated, and one of the high-level staff for this hospital ended up in the hospital with chest pain, and it ended up being a Takotsubo. So I said I wanted to publish a case report of the first JACO-induced Takotsubo case, but I was discouraged from doing that, let's just say. So with that, that's acute stress, and that's broken heart syndrome. But what I will tell you is that way more impactful in health is chronic stress. Chronic stress is associated with all the bad stuff: heart disease, stroke, cancer, dementia. And today we're going to talk to an expert in how to make sure chronic stress is not on the list of things that can kill you. And it is my honor to welcome Dr. Melissa Lewis-Duarte, a stress management expert. So Dr. Lewis-Duarte has a PhD in organizational psychology, as she likes to tell me. I'm not a therapist, and is a nationally board-certified health and wellness coach who takes an integrative approach to stress management. She works with my patients to increase their health span. Welcome to the Healthspan Podcast, Dr. Lewis-Duarte.
Thank you. I'm happy to be here.
We're just excited to be here. I mean, when I first met you, I just recognized, one, your level of expertise, but number two, how much you care, and then the unique approach that you have to such a common problem that I really didn't have tools for. You know, I've always, as a physician, I especially as a cardiologist. So cardiologists see people who have panic attacks a lot. They like a lot of times their panic attack is manifest as chest pain, chest tightness, shortness of breath, a racing heart, and they think, oh, it's a heart problem, and they come to see me. Or the flip side of that is somebody comes in and they have less acute sounding symptoms, but they're like, yeah, it might be stress. I got a lot of stress in my life, and I've never been able to really have great direction for them. Now I do, and I'm so grateful for that. Tell us a bit about how you came to focus on helping people manage stress.
Yeah, and I just want to say when we met, we really did hit it off. Our perspectives on the value in talking to patients about this really collided. And that's because I had learned firsthand what it's like to deal with overwhelming stress and anxiety. So as a health coach now, I help people set goals and accomplish them in relation to health, particularly for your patients in relation to managing their stress. And the way I got here is, like you said, I was an organizational psychologist, so I did business consulting. We talked about motivation, goal setting, group dynamics, leadership, all of that stuff. I took a few years off. I had 3 boys in 4 years, and
that wasn't stressful.
Not at all.
Yeah.
And my husband, who is also a doctor, was finishing his residency and fellowship, so we're moving across country. And I ended up putting all of my needs on the back burner and found myself anxious and dealing with the demands of caregiving. And 2 of our pregnancies were high risk. My 3rd son lived in the NICU for 6 months before coming home. And it was overwhelming, crushing stress. And I realized when going to my doctor, over the course of a year or so, got diagnosed with both POTS, which is postural orthostatic tachycardia syndrome, and vertigo, that stress was causing me a lot of physical problems. And it got to the point where my doctor said, we might need to consider some medication to decrease your stress and anxiety. It's causing you so many problems. And I knew in that moment that although there was nothing wrong with taking medicine for that, I wanted to at least try the things that would help me to feel better and to feel well before doing that. All the things that we aren't really talking about most of the times with our doctors. And those are like the lifestyle modifications. And so I started writing a blog about it, and sort of like that was my way to keep myself accountable, and doing research, writing about it, trying it, and finding what would work for someone who is overwhelmed and really busy. And after I did that for a year or so, I felt so much better. And I thought, okay, now what? And that's when health coaching became like the obvious next step to help other people do the same thing.
It's so interesting to me that you came to this system to help people with their health through business. Right. And I had a similar thing in that I was trying to help people with their health, and it really came together for me when I read a business book about building systems. And, there's also one of the things that really resonated with me is I looked through your information and I realized that we had the same, foundational approach to those issues. And so ironic. Anyways, what are the challenges for assessing the impact of stress is it's just not easy to measure. If I wanted to know, okay, well, how's your potassium level, affecting whatever, I'll measure the potassium. I just do a simple blood test. But stress is not only there's so much diversity in stress, but also how we feel it and also how it impacts us. How can people know when stress is negatively impacting their health? Or I'd like, as you phrase it on your information, is how do you know how can they tell when they've reached their limit?
Yeah, and I would say, I mean, that is part of the challenge with stress is that it is so vague. The symptoms are different for everybody. But most of us know that our limit has been reached, or we at least feel it. And it's different for everyone. So sometimes people feel, like you had mentioned before, this like pressure in their chest. Some people, it's more, what's happening upstairs where they're worrying all the time, or they find themselves, distracted and unable to focus, or it starts to affect their sleep. And so there's this whole constellation of vague symptoms that unfortunately can be associated with a lot of other things. And so usually it's up to the patient to bring it up or to know, like, okay, I can't keep going like this. I want to feel well, but I don't really know what that means anymore.
Yeah, it's working at a tertiary referral place, meaning that's where everybody goes when they can't get answers somewhere else. I learned early on how many people that they don't have a diagnosable pathology that we can explain their symptoms. And it used to really frustrate me. In fact, I almost left medicine when I was in my residency because I was so challenged with the people that I felt I wasn't helping them, and I felt like it was me, that I was the problem. Eventually I realized I didn't have those skills. Like, that wasn't in medicine. I tell patients this a lot. Medicine is really good at identifying things that'll kill you and things they can fix, but that doesn't mean everything. And how many of those people where it's stress and yet they keep going to cardiologists and other doctors and getting test after test after test after test. Gastroenterology is a really good example of that, right? A lot of stress manifests in nausea, vomiting, diarrhea, constipation, and irritable bowel syndrome is the common catch-all phrase in that. They get a lot of procedures, they don't get the solution, and it's managing stress. So another challenge with stress is, well, it's part of life, right? Mm-hmm. Like and it can be a really good part of life. Yes. As well. How do you make that distinction or help people make that distinction between good stress and not so good stress?
Yeah, I would say that it's really up to the person. Like, we're all so unique that if it's starting to cause you problems, whether, like for me, I was having all kinds of physical problems that were developing, and I knew that it wasn't just something where I could change one thing or take one pill, that it was something much bigger and more holistic in my approach to how I was spending my time and living my life. I would say for chronic stress, it often will result in things that then lead to disease. So we've talked about. So we start to have like chronic issues with sleep or insomnia, or we start to have develop like heart disease or other types, but that's really far down the line. And so the goal is to be catching this much earlier. And it doesn't even have to be that stress is so much of a problem that you're seeking out a solution. A lot of the things we're going to talk about today are things that anyone can incorporate into their life and feel better and feel healthier. You don't have to wait until there's a problem before you start addressing it. In terms of the good stress, I'm glad you brought that up, because some stress is really good for us. I mean, when we talk about motivation and goal setting, we don't want to set a goal that's so easy that it's not going to provide some motivation to us. A lot of us grow our most when we experience some level of stress because we're having to learn something new or do something uncomfortable. And that's good stress. That's good stress to have. When it starts to impact other areas of your life or your ability to feel good, that's when we have to start talking about, more active approaches to solving the issue.
Yeah, that the analogy that pops in my head is exercise. If you look at exercise, boy, that's a stress, right? Mm-hmm. Yeah. If you break it down into components, you could get off the wrong path, you'd say, well, should I exercise because it increases inflammation, it increases stress, it leads to this strain on my heart. There's a risk to high levels of exercise. Oh, I probably shouldn't do that.
Right.
Then, one of my mentors, very famous cardiologist, he is a really good cardiologist. Maybe not the best in lifestyle, advice, but he would commonly, famously say, well, you only have so many heartbeats, so don't waste them on exercise. But we know that exercise is one of, if not the most powerful tool. It's in the top, couple of interventions, fountains of youth. That's what can help us live long, healthy lives. What are some of the biggest myths about stress that you encounter in your practice and the harmful ones? What are the ones that you really need to dispel?
I think really a foundational thing for people to understand is that we really can't separate the mind and body. So even though in Western medicine, and I think this gets back to one of the challenges you had experienced early on in medicine, is this idea that, well, we got to check these boxes, and if we get all these checks in the right spot, then we know exactly what the problem is, and we know the right treatment. Whereas there's so much that's really vague and is impacted by what's going on in your brain, what thoughts you're having, and how stressed out you're feeling. And so it's really important to recognize that when we are stressed out or we're overwhelmed, it quite often can manifest as a physical symptom. And when we are sick and dealing with those sorts of issues, quite often it can then cause us worry and stress. And so we really cannot separate those two. We have to talk about them together. And that's why I think there's such an opportunity. And one thing that I think is wonderful about your approach to medicine is that you encourage your patients to go through the coaching process as well, so that we're thinking about much more comprehensive approach to healthcare rather than waiting until someone develops a disease and then treating that.
So that sounds suspiciously like an integrative approach.
I am planting a seed here.
Yes,
you're right.
Yeah. So that just my experience as a traditionally trained doctor, we're trained to look for disease and then apply a procedure or prescription to treat that disease. And I realized early in my career that there were just really critically important aspects of health that we weren't addressing: nutrition, physical activity, sleep, and stress. But if anything, my experience since then has just continued to become more encompassing of the importance of that integrative approach. So mental health has always been, for me, a black box, basically. Mm-hmm. Like, I know it's important, but man, I don't know anything about it. You know?
And I think that's really common. I can say this as someone who sort of was watching my husband go through medical school as well, and like that traditional training where they are kept so separate. It's like psychiatry is one area where we talk about mental health, and then all other, parts of medicine are their own little silos. And in reality, the body just doesn't work like that. Mm. And so it's helpful to be able to open up to that perspective that there is more than one thing going on here, and it's really hard to isolate. And sort of piggybacking on that from the patient perspective, you had asked me sort of to think about myths, and another one is that people feel like they can't ask about these sorts of things. Like, maybe I shouldn't ask my cardiologist about this or mention it, or maybe it's weak to talk about mental health. And it's my goal, and it was my goal in starting the blog in the very beginning, to just start talking about these really difficult issues about being anxious and being uncomfortable or feeling overwhelmed, so that people could normalize it. And there's been a pretty good shift, I'd say, in the last few years in trying to normalize that. And my hope in coming on a podcast like this or us talking about it is that we're opening the door and telling other people it's okay to ask for help or to mention any sort of symptom that you have that you think would be helpful to discuss with your doctor.
It's such an excellent point. Well, frankly, even if we wanted to ignore the impact of mental health on overall health, the world is just not going to let us.
Right.
Like, you know, I don't know if this is accurate. This is something I read and just floored me, but it was an article in JAMA, Journal of American Medical Association, one of the premier medical journals. And in the article, they stated that 40% of young people have anxiety disorder.
Yeah, it's getting really bad. I just read a really good book called The Anxious Generation. It just came out and talking about that. And it makes me worried for my boys who are young, and they are so inundated with things that we weren't even thinking about or looking at a couple decades ago. And so this is a real issue that we should be talking about with our children as well, so that they feel comfortable mentioning these sorts of things, or that they even have the vocabulary to talk about it.
Yeah, this resonates with me so much because I grew up in an era, in a time, in a family where there certainly was not absence of mental health issues, but we did not talk about them.
Right.
You know?
I mean, that's still around today.
Yeah. And now I'm realizing that there's so many aspects to mental health. Like, you know, people are really familiar with the prescription approach. You know, hey, you have these, you meet these DSM, what are they on, 4 or 5 now? I don't know.
Yeah, farther than
6,
that, yeah.
Maybe. Then here's a prescription for that. And medications can be effective, no doubt. But oftentimes there are more foundational things that could be used. The cognitive behavioral therapy, I know, as a burgeoning evidence base, meditation, mindfulness, all of those things. I'm interested from your perspective with such a great educational background, you'd mentioned in your information a lifetime pursuit of helping others grow. In regard to stress, what are the evidence-based strategies that you recommend or you guide people towards? And how do you tell what's going to work and what's not going to work?
The last part is really key. And one of the things I want to stress is that not everything works for everyone all the time. And it's okay to try a couple of things, or to say, you know what, I heard my friend meditates, but that doesn't work for me. That's okay. That's part of, working at the individual level, is finding what will work and being open to trying it. One thing that I always recommend is to simply develop a breathing practice. And by calling it a breathing practice instead of a formal meditation, I feel like it takes the pressure off a little bit, because a lot of people say, oh, I couldn't sit still, or, I'm not like a monk practicing where I can do a formal meditation. And that's where if we just talk about taking a few deep breaths, it's like, oh, well, I could do that. And so the one that I think is really an easy place to start is simple belly breathing. And so many of us are breathing, particularly those of us who are under chronic stress or have anxiety, we're breathing like up into our chest. And so we're taking these short, shallow, rapid breaths, and we're constantly sending the signal to our brain and like reinforcing that we're stressed by doing that. And so that was really helpful for me to learn that, the brain is open and receiving all these signals all the time from our body. And then it's using that. It's this great prediction machine. It's using those signals to then interpret how we feel. And so if we are stressed and anxious and we don't want to feel that way, we can override it by changing those signals. And breathing is one way to do that. And it's simply just breathing down into the belly rather than up into the chest. That's a really great starting place. And we know that this helps to decrease blood pressure, to slow down your breathing, to help you to feel better. It can help with sleep issues, and it just goes on and on and on. So it's a really great place to start.
I just want to keep on with the strategies and how you figure out what works for people, but I just want to comment on the breathing thing. So I was admittedly a lot of what you might call a Neanderthal when it came to these things. Like I'd be like, if I can't see it on an echo or a lab test, come on, that's not important. And so when I was first exposed to the breathing, controlled breathing, whatever you want to call it, things, I'm like, oh, that's a bunch of woo-woo, whatever. But But I also realized that stress was impacting my health, my quality of life. I like, okay, I need to get a little more humble here, and I've gotten a lot more humble over time. But one thing that was impactful for me was reading that the Navy SEALs did the box breathing.
Oh, yeah.
I'm like, okay, if these are the most, badass people in existence, and if they're teaching them to do boxed breathing and they think is that valuable, I probably need to figure out that this might be
and I think some of that healthy skepticism's good. I felt that way when I started writing the blog. I was like, I don't know, like this sounds a little touchy-feely to me, and then I would try it and think, oh, I guess this could work. And so it's having a little bit of that openness and curiosity that's really helpful if someone's trying to find what works for them. And if that one belly breathing or box breathing doesn't work for you, there's 100 other types of breathing that we could try. And so that's what I always say to people is be willing to try a few things a few times.
Yeah, that's medicine, frankly. Like anybody who has clinical experience, I love your comment about, being skeptical. I like when my patients come in with a bit of skepticism because we have to be a little bit skeptical in the world today. There's all these overpromises and, wacky stuff out there. Being skeptical is just being smart. But, being too skeptical where you're like, okay, I'm not willing to try anything. You got to, and I also will default to, let's be results directed. If you come to me to solve a problem and let's say somebody, says, look, I want to improve my health, and they're, 50 pounds overweight and they're smoking and they have uncontrolled diabetes and high blood pressure. And then I start talking to them about ways they might be able to improve their health. And they say, I already got it all figured out. I don't want to be told what to do. Let's look at the results. Like, are you getting those results? That I think helps, frame that as, where you can go. The other thing in medicine, and whenever somebody says, oh, I have the solution for all people, like if you'll just do the keto diet, or you'll just be vegan, or you'll just do CrossFit or do HIIT or whatever that is. If I love this quote, I should say this every podcast. I don't remember who said it, but it says, for every complex problem, there's a simple solution, and it's wrong. and I love that because I don't know how you're going to get your blood pressure better. I don't know what the right combination of medications, other strategies are going to be. But what I will tell you is that in 25 years of doing this, there's not anybody I haven't been able to figure it out. So I don't know what yours is going to be, but we're going to work together to figure that out. That's the only way you can do it.
Yeah, and that's really, that's the crux of health coaching as well. So we don't act as the experts who know everything to tell you what to do. Instead, we work with you to figure out what you think would work for you, because our patients are the experts in all things about them. They know what they like and they don't like. They know what they want to try. And the best places to start are those things that already are piquing their interest and already things that sound attractive to them, and trying to figure out how do we incorporate some of that into their life without telling them what to do.
That's so good. I have patients, come to my practice and they have a problem they want to solve, AFib or heart disease or diabetes or whatever. And, and I tell them, okay, we're not just going to write you a prescription. You're going to work with my health coach at least every month. You're going to meet with them. Many people are like, oh my gosh, I've wanted this my entire life. Like, this is crazy. But some of them will wait, health coach? I already know nutrition and physical activity, or I don't want anybody telling me what to do. And I have to go through that and say, well, that's not health coaching. They're not, are they experts? Do they know things? Are they going to share things with you that may, be informational? Yes, that's not their primary goal, is to educate. They're there to be a partner for you, to help you discover where your best opportunities are?
Yeah, it's really a partnership. And I always say it's not a knowledge issue for most people. It's a habit issue.
Yeah.
And so it's how can we work with you to develop the habits that you want to have more of in your life so that you feel good and healthy?
Yeah, there's a marketer that says we need to, we need to be reminded more than we need to be told. And I like that, approach. I'll give a quick example. This is off the stress, but just on the health coaching thing. I use one of our health coaches as my health coach. And of course, I would say I don't know that I need a lot of education in health things because I've designed the program that all these things. Not that I'm the world expert. I'm always learning. But I don't use her to teach me things. And yet, just recently we were talking about some health things that I wanted to accomplish, and she's just asked me questions. So, when were you last where you want to be? And I'm like, it was about this time. And she said, what were you doing then? And I said, I was doing this, this, and this. And she said, great. And what are you doing now? Oh, mystery solved. Right. I had a blind spot. I needed that. And we all do. And so if you like the people that are longevity focused, they understand. If I just stick with this, try the things that I've known in the past and never look for those other opportunities to improve, I'm going to fall behind. If you're not growing, that's a business axiom, right? If you're not growing, you're dying. I think the same thing applies to your health.
Yeah, for sure. And that's what coaching helps you to make sure that you keep doing that in, the areas that are important to you. So so the breathing was one of the things that, I recommend for a starting point. It's a really good way to a physical approach to managing stress. There's also more mental components to it. And so one that a lot of people are open to is the idea of a gratitude practice. And so, when I first thought about, was learning about this, reading on the research on it, I was like, okay, I'm going to sit around, I'm going to list some things. And it's sounds very Pollyanna. I'm just going to list all the things that make me happy. But it's not that. It's this consistent practice of identifying things in our lives that make us happy or that bring us joy, whether it's small or big. And the sort of what sealed the deal for me was this understanding that in psychology, we have this negativity bias. We just are always scanning the environment for threats, and we spend a lot more of our mental attention on things that go wrong than things that go right. And it can really bog us down, especially in the modern world where we don't necessarily need to be scanning for threats nearly as much. And so this is a way that we can actively work against that. We can sort of, balance it out by practicing focusing on more positive things. And so research has actually shown that we can increase our happiness levels by about 25% just by practicing having a consistent gratitude practice. This is something that takes maybe 3 to 5 minutes a day to sit down and either write out or say out loud or think about as you're going to bed 3 good things that happened today. And it's really that simple. A lot of the stress management practices are simple things probably our grandma knew or could have told us to do. So it's just translating that into habit.
Yeah, just a testimonial in support of that. I was, this was maybe, 5, 6, 7 years ago. One of my scribes shared with me a book called You Are a Badass. And she said, look, it's not really for you, but there's a chapter in there, and I can't remember which one it was, that I think you'd really like. And so I got the book and I read the whole thing. It's fascinating. It's a great book. One of the things he talked about in there was a gratitude practice. And I implemented that. And I realized I'm a problem solver. That's what I love, solving problems. That's the thing that, and my day would start eyes open and okay, let's think about all the problems I need to solve today, know? And I'm my stress levels, my cortisol levels are through the roof, getting out of bed. And I changed that to every morning now before I get out of bed, I think of those things I'm grateful for. And it has been a paradigm shift for me.
Yeah, it really is. And I experienced the same thing, a little bit of skepticism. I tried it and it's like, oh, this really does help me change my perspective without sort of being, too Pollyanna-ish about life.
May I ask you about resilience? And I don't know if this is part of your practice, but I've been really intrigued by this idea of resilience, because when we think about the threats for our health, our longevity, I would put resilience or lack of resilience like up at the top, like as dangerous as heart disease and cancer and dementia, because as a doctor, I've seen it over and over and over. Patients, later in life, they're struggling, their health, and then they face a loss of a spouse or a child or whatever, and they just don't recover from that. Or, but another example, my grandfather grew up in the Four Corners area of New Mexico, Utah, Colorado, and he believed that was the God's greatest area. Like, he couldn't understand why the whole rest of the world didn't want to live there. Like, he was born there, he lived there, he had his career, his family, his all those things, and he faced terrible things. He was a POW in World War II, which was just a devastating experience. He lost both of his children at relatively young ages, but he went through all of that. But when he was 91 years old, and he had to move away from his home, because he needed to be in an environment where he could be cared for, and have the help he needed. He died within 4 months. And I remember talking to the doctors, and they're like, we can't figure out what's wrong with him, but he's losing weight. He's lost inch. He's just like, all the tests are fine. He's dying though. And he died. How do you see, or do you see resilience as part of stress management? Is that something that you think about or? For
sure. Okay. That's part of my, everyday vocabulary now. This is going back to that whole idea of an integrative approach. So when I decided I wanted to do health coaching, I sought out a program through the Andrew Weil Center for Integrative Medicine. And through that training, learned about these core areas of wellness. And I loved this perspective because it helped me to gain a better understanding of how mind and body are connected. And so there are core areas that all work together, influence each other to impact our overall well-being. There's like the things that we've talked about, like sleep and nutrition and exercise. And one of those core areas, though, is resilience. And resilience is, I like to think about when I talk to people about it, it's our bandwidth. Right. And so if we're thinking about the internet and we have really bad bandwidth, right? It's like all glitchy and things aren't functioning properly and everyone's frustrated. And when we have really good bandwidth, then everything is smooth and flowing, and we're able to bump over little glitches. And resilience is like that. It's our ability to bounce back when things are frustrating, or whether it's a small thing like my kids are fighting as I'm trying to leave the door today, coming down here, or it's something huge like losing my home after where I've lived for, decades. And so it's really key, all of these stress management pieces, all of these activities and techniques we can use to bolster our well-being, facilitate that resilience. And the reason I like the integrated perspective is because we know that none of these exist in isolation. So when our sleep and our relationships and our nutrition are suffering, our resilience suffers as well. And when those things are functioning better, our resilience is bolstered. And so it's like the bad news is that when one area suffers, many other areas suffer as well. But the good news is that when we work on one of those areas, it sort of like trickles down into the other areas. And so that's what I try and get people to work on when they're trying to build their resilience or manage their stress is choosing something to work on to feel better, because we know that that will also impact their resilience.
I talk a lot in my practice around about the concept of a vicious cycle and a virtuous cycle, and exactly what you just described. How many people will come in, have a health issue, a health scare, and they'll say, it started 10 years ago. I injured my back, or there was, I took a job that was really stressful, or there was some kind of loss, and I quit being as active, and then I gained weight, and then that led to back problems, and then I started drinking more, and then, they got into this vicious cycle, and then woke up and said, how in the world did I put on 50 pounds? Like, who is that person in the mirror? But, the opposite works as well. We can create a virtuous cycle where, by helping get your sleep better, you're able to be more active, which leads to you being more engaged in your social, connections. Like,
exactly.
All of those things. That sounds like what you were talking about.
Yeah, it's this upward spiral. And what I would tell that person who's coming to you, 50 pounds heavier, and all of these things are going wrong, it feels overwhelming for a lot of people at that point to then, what do I even change? Because I got to change everything. I have to eat better. I have to exercise. I have to sleep better. And that's what stops people. And so the key is to focus on one small thing. What is one thing? And knowing, because from this perspective, we know it's going to affect other areas positively as well. So we don't have to do everything at once if we choose a starting point.
Yeah, that time is an amazing tool, very powerful tool in the positive or the negative. Yeah. And, we tend to overestimate what we can do in a short period of time, a day, a week. How many people come in and say, well, I've been working with you for 10 days now, and I've only lost 3 pounds. Like this program's not working for me. All right. But how often I'll see people a year later and they're like, I really didn't even realize how much weight I've lost or how much my blood pressure, and I pointed out to them, I'm like when I saw you first, your blood pressure was here, you were diabetic, you were, cholesterol was through the roof. And now look at these numbers, and that's the magic of time.
For sure.
Yeah. So, and I think that's where health coaching and expertise like what you bring really provides value. Can people figure that out themselves? I don't know. Maybe. I mean, I'm not saying that these things you can't. There's YouTube videos out there, right?
There are. And I mean, really, there's so much information out there. It's really about choosing something, a starting point, and working on that. Yeah.
And that's where I think health coaching and expertise, it can be a real asset. It's not that they need a lot of education or that they can't get the education on YouTube or wherever they get it. It's that they need somebody to help them take that first step and reassure them and get them through that change valley of death, that where you feel like you're doing things and no results, and it just takes some time.
Most of us do it wrong. I mean, honestly, if we're left to our own devices, we're going to set a goal that's way too big, way too complicated. We're going to, we're not going to think it through resources we need or the support system that we need. We're not going to think about baby steps and how to do that. And then we're also not going to have anyone helping sort of like show up as an accountability partner and say, like, how did it go? When we fail at something, then it's discouraging and we throw sort of the baby out with the bathwater. And then we take so many steps back, it takes us months to even start thinking about that change again. And that's a cycle that people can get into, where coaching really helps to stop that, because it doesn't mean that someone who's working with a coach isn't having those setbacks, but they're still meeting with someone and they're talking about it and they're learning from it and they're being able to leverage that and to change something, to do these course corrections so that doesn't continue to happen.
Yeah, such good insights. Well, our time went by so fast as it does, and I'm just so grateful for your time. And I know a lot of our listeners are going to be really interested in learning more about you, your practice. How do people connect with you that might want to learn more about what you do and how you help people?
Yeah, Yeah. So, well, for the HealthspanMD patients, obviously they can see me through your coaching services. But for everyone else, I have a website called Working on Calm. That's what my blog started as. And I share videos and articles all the time about these simple but scientific or science-based approaches to a calmer, healthier life. And so there's all kinds of free resources on there, things to try. And if they want to sign up for my newsletter, it's called Take 5. And people who sign up, I share a guide, 5 ways to decrease stress and anxiety in 5 minutes or less, because I think those really short practices are helpful for a foundation. So they can find that at www.workingoncalm.com/newsletter.
Well, I'm so grateful for you being with us, for the great work you've done with my patients. I get such positive feedback from them about their experience working with you. And I'll also put a plug in for your newsletter. I love getting the Take 5 newsletter. There's just, it's good information, but it's actionable things as well that we can, all implement. And one thing I'll leave people with, I think is a concept I'm coming to, is that, I spend time every day on my physical health. That's like non-negotiable. I'd like to spend more time, but I get my 45 minutes or so every day I get on my physical health, and I pay attention to my nutrition. I spend a lot of time on that as well. Mm-hmm. Like, what am I going to eat, planning, preparing, all those things. I'm learning that I need to be, spending time on my mental health as well.
Yeah, and it doesn't have to be overwhelming. There are these small moments and opportunities throughout the day where we can, if we have a technique we want to try or something to do, we can fill it with that, especially instead of picking up our cell phone and scrolling. That we can use these little opportunities to be a little more purposeful.
Yeah, but that cell phone's screaming at me.
I know it is.
Pick me up. Yeah. Well, Dr. Lewis-Duarte, thank you so much for being with us. Can't wait to have you back.
Yeah, thank you.
All content created by me and HealthspanMD is for general informational purposes only and is not the practice of medicine. No doctor-patient relationship is formed. The use of this information is at the user's own risk and is not a substitute for professional medical advice, diagnosis, or treatment. Hi, I'm Dr. Hurst. We created HealthspanMD for people who are dissatisfied with healthcare. Common complaints about healthcare include difficult access, poor communication, rushed appointments, disease-focused or sick care with little interest in helping people get or stay healthy, and little to offer beyond a prescription or a procedure for optimizing health. This type of healthcare is unacceptable, but most aren't aware that they don't have to accept low-quality healthcare. HealthspanMD provides exceptional medical care. That means appointments when you need them, time to talk to your doctor, get your questions answered, understand your problems, and get a clear plan to achieving your health goals. But it also means a comprehensive, proactive approach to your health that goes beyond prescriptions and procedures. As a HealthspanMD patient, you will get our expert, physician-led team of doctors, health coaches, dietitians, exercise specialists, mental health, and other health professionals to help you take advantage of your best opportunities to prevent, treat, and even reverse disease. And you may be eligible to have our care model reimbursed by Medicare and some commercial insurance. If you're no longer willing to settle for low-quality health care, schedule an appointment at HealthspanMD to experience health care as it should be.